You are watching EAC News. Thanks for joining us. Omicron variant of coronavirus is spiking in London and some other parts of the country. In the capital, it is representing approximately 40% of the current cases. Omicron is causing hospitalisations in the United Kingdom, and sadly, at least one patient has been confirmed as dying from that variant.
The British Health Secretary Sajid Javid has announced on Monday that the Omicron variant of novel coronavirus is spreading at a phenomenal rate. He advised people should get an additional dose of the vaccine because double-jab people are vulnerable. Javid has warned that Britain faced a tidal wave of infection, which could lead to a high number of hospitalizations and overwhelm the healthcare system. British scientists found 2-dose COVID-19 vaccines regimens do not induce enough neutralising antibodies against the Omicron coronavirus variant, indicating that increased infections in those previously infected or vaccinated may be likely.
What we've learned about this new variant, Omicron, just in the last week is that, first of all, it's spreading at a phenomenal rate. The number of infections is doubling every 2 or 3 days. There's going to be a tidal wave of infection. The second thing that we've learned in the last week is that 2 doses of the vaccine are not enough to protect you, but 3 doses, a booster shot, will be hugely effective in protecting you against symptomatic infection.
Researchers from the University of Oxford have published results on Monday from a study yet to be peer-reviewed, where they analyzed blood samples from participants who were given doses from AstraZeneca, Oxford, or Pfizer-BioNTech in a large study looking into mixing of vaccines.
And what we are seeing is, because of this phenomenal growth, we're seeing a huge number of infections. And even if this turns out to be milder than the Delta variant, because we don't know about how severe it is yet, but let's assume for a second that it's milder, it will still lead to a high number of hospitalizations because it will still be it might be a smaller percentage of people that are severely ill, but it'll be a smaller percentage of a much larger number.
The results come a day after British Prime Minister Boris Johnson has warned that 2 shots will not be enough to contain Omicron, following findings from the UK Health Agency last week that boosters significantly restore protection against the variant. The Oxford study said that there was no evidence yet that the lower level of infection fighting antibodies against Omicron could lead to higher risk of severe disease, hospitalization, or death in those who have got 2 doses of approved vaccines.